Hi, this video will provide logistics of CCD from health plan's perspective. The milestones of this presentation starts with highlighting EHR interoperability and meaningful use, which are the government rules. Then we will understand the CCD from high level. After that, we will understand the conceptual differences of PHR, EMR, and EHR. Fourth, we will view the four methods of exchanging CCD. In the fifth milestone, we will review health plan's contribution towards CCD. And last, we will show how Real-Time 2.1 can be beneficial for health plans. In the first milestone, we will review the highlights of government requirements of EHR interoperability and meaningful use. The source of this milestone is www.healthit.gov. Healthit.gov has identified some key points related to EHR interoperability, starting with encourage development of health IT standards and how applications interact with users, how systems communicate with each other, and how information is processed and managed. Finally, how consumer devices integrate with other systems and applications. The second part is meaningful use stage 1, 2, and 3. Stage 1 is related to data capture and sharing, where stage 2 is towards advanced clinical processes and stage 3 is towards improved outcomes. Now in the second milestone, we will understand CCD. CCD is a data exchange format which complies with the government rules and is built upon two formats. First, Continuity of Care Record CCR developed by ASTM International. Second, Clinical Document Architecture CDA developed by Health Level 7. The other organizations involved is IHE, which is an initiative by healthcare professionals and industry to improve the way computer systems in healthcare share information. The other organization involved is HITS, Health Information Technology Standard Panel, which is the governing body of CCD. In the third milestone, we will review the conceptual differences of patient health record, electronic medical record, and electronic health record, which uses the CCD format. To understand the conceptual differences, let's look at the unique attributes. In the fourth milestone, we will review four methods of exchanging CCD, excluding ACO model. First method is through Regional Health Information Organization, where medical data is interconnected and data is shared among all connected entities. Second method is that all entities maintain their own data and connects with HIE to retrieve additional data from other sources. Third method is using Connect software, a federally funded project provided by Nationwide Health Information Network. In this method, all entities install and configure the open source free software. Through this approach, entities can exchange data with all other entities using the same Connect software. The fourth method is using Direct software, a federally funded project also provided by Nationwide Health Information Network. In this method, each entity can directly connect with other entities using Direct software. or all entities just connect with HISP, and HISP becomes the exchange gateway. In the fifth milestone, we will review health plan's contribution towards CCD. Here on the right side, you can see the structured sections of CCD, and the highlighted in red are contributed by health plans. Now let's look at the data source. PCP and demographics are pulled from eligibility data source and reported in the CCD header. Encounters, procedures, and medication are pulled from claims data. A NCQA HEDIS measure process runs analytics on claims data and builds the data source for problems and gaps in care. This screen shows the actual CCD on the left side, which is for machine readable, and on the right side is an internet browser view of the same CCD for human readable. Now let's look at the gaps of current CCD. First, the provider reports procedure on a CCD using ICD-10 codes, but when it is retrieved back from the health plan, it contains ICD-9 procedure codes, because the billing software reports with ICD-9 codes to the health plan. The other gaps are related to limitation of fields in CCD. Health plans have more data to report, but limited reference fields are in CCD, such as reporting alerts, medication, and gaps in care. Let's look at one gap related to plan of care section. On the left side of the table view, you can see two fields available in CCD, where on the right side of the table shows many other fields available in health plan. The solution for this problem is to map additional field in the activity field of CCD by concatenating multiple field names with their values. This is how the CCD will look like when the mapping is completed. You can see the two fields of CCD in red, and below that the data source field names are in green, the values are in blue. Now once again, let's look at the CCD. At this time, we will focus on plan of care section. Here we can see that health plan has mapped multiple fields in one section. Health plan is a key contributor to CCD and plays a vital role towards quality of health. It detects gaps in care through HEDIS measures. It detects medical condition through claims data, identify medication gaps and frequency, and initiate preventative care. In this sixth and final milestone, we will show how a cloud-based real-time 2.1 system is applied in the 4 methods of exchanging CCD, which was mentioned in the 4th milestone. Let's once again look at the 4 models of exchanging CCD. For health plans, it is costly and time-consuming to adopt to all 4 methods unless they install Real-Time 2.1 as a single solution, which serves as a front end to all 4 methods. Thank you. For further information, you can contact us at info@edix12.com, and our sales executive will be glad to assist you. Thank you.